Hey guys, this is Chris Dewey with May River Medicare in Old Town Bluffton. And what I want to talk to you about today is the three biggest mistakes that I see folks make when it comes to Medicare annual enrollment. And although I'm licensed in over 40 states, I've got clients from California to upstate New York, to a lot of them here in Bluffton, South Carolina. What I notice that's widespread in our little Bluffton low country area, unlike all the other areas I do business in, particularly in Bluffton and Hilton Head, the biggest thing that I see is people get a supplement at 65 and they never look back. They're so happy that their plan G pays all their bills. They're like, I like this insurance. Now keep in mind, Medicare supplements are standardized by the government. So a plan G with Blue Cross Blue Shield offers identical benefits as a plan G with Humana, ARP, Medico, Allstate, so just want you to be aware, this is the one kind of insurance that you really want to keep an eye on an annual or biannual basis. Let me give you an example. This was 4 years ago. I sold a gentleman in the 29910 Bluffton zip code. I sold him a policy for $103. That's a plan G, all right? Now, he just got a premium change increase from Mutual of Omaha. His new premium is $188. So just in the last 4 or 5 years, his premium's gone from 103 to 188. Now, if we look down here, if somebody decides they want to jump on Mutual of Omaha, that's only going to cost him $112. So why is this guy paying $188 a month? Rate increases, guys. It's that simple. So what you want to do, what I did for him, we got him on the Humana plan, okay? He and his wife. So he went from 185 down to 102. Same identical plan G. It pays all your bills. But if you're semi-healthy, if you don't have COPD, heart attack in the last 2 years, your meds are okay. I know which companies to pick based on the particular health conditions that you have. Different companies have different underwriting standards, and what I'm good at is finding the one that fits you the best. So that's number one is, guys, shop it out. You're on Blue Cross for 6 years, and your premiums are $90 less than, say, Allstate or Humana at 102. All right, I mean, if we go up, and this is Blue Cross at 125, guys, if you've had Blue Cross for 4 years, 5 years, you're paying a lot more than 125. Trust me, all right? So that's the number one thing. The number two thing, Advantage plans. If you weren't educated enough to get a Medicare supplement, a Plan N is what my favorite, or Plan G, when you first turn 65, maybe you got sick, you're stuck. You're on Advantage plans for life. A lot of you folks out there. Or you like the Advantage plan because you've been healthy, you haven't had to use the plan, you haven't had to have pre-authorizations, denials, all that fun that my clients experience with Advantage plans, but you just want to shop it out. The number one thing that people don't look at, they look at dental, they look at vision, they look at doctor copays. Number one thing you want to look at after your drugs and doctors in the list, you want to make sure your doctors still take it, and you want to make sure that your drugs are still on the formulary this year. Just because they were in the provider list or on the drug formulary last year doesn't mean they are this year with Advantage plans. So you got to look at that annual notice of change. If you haven't looked at that, call the company, have them send you another one, or look online at it. But you want to look at that. So maximum out of pocket. In Beaufort County, there's really only 3 plans, maybe 4. Medicare Advantage plans. If you're not on Medicaid, there's only really 3 or 4 worth looking at. All right, and for compliance reasons, I'm not allowed to give you company names or plan specifics. Isn't that great? So I can't educate you to make an informed decision. But what you can do is you can click on the calendar thing below and schedule an appointment with me. So maximum out of pocket. And the other thing is, a lot of my clients are using alternative methods to get their drugs. They're looking at the Medicare Part D standalone drug plan or their Advantage plan, built-in drug plan, and I have found unique new avenues thinking outside the box where you can get your prescription drugs for a lot less than using your prescription drug card. GoodRx is an example. So that's the second thing. And the third biggest problem that I see is people just assume the Plan G supplement's the best. Keep in mind, there's a video below this that you can watch. It got over 21,000 views on my YouTube channel. May River Medicare Insurance. If you go to YouTube and type in May River Medicare Insurance, you're going to see a whole library of Medicare videos that can help you, all right? Yeah, the last thing I was going to talk about, so what did I talk about? I talked about the supplements. You need to shop those out. Showed you the rate increases. With the Advantage plans, maximum out of pocket. The other thing is, some of these companies are giving back. There's a company here in Beaufort County that pays you $100 a month. It's a Medicare Advantage plan that pays $100 of your Part B monthly premium. What I've been able to do, and there's a company out there right now that no underwriting necessary between the ages of 60 and 79. You can get this. You can take that $100, use the house money. You can take that money and we can make sure that we develop a customized plan. It's an indemnity plan, hospital indemnity plan with a cancer rider, outpatient surgery. You'll never pay a hospital copay again all through the year. That's going to break you. A lot of these companies are $300, $350 a day for days 1 through 5 as an example. The other thing that's going to kill you, if you get cancer, all these Advantage plans, they pay 80%, you're stuck with 20%. So this year, for example, some of these companies have $8,700 maximum out of pocket. That's how much you'll spend out of your own pocket before they shut your side off, and then the insurance company pays for the rest of the year. But it resets January 1st. So cancer, you'll pay 20%. You'll hit that maximum out of pocket in no time. Also, I mentioned maximum out of pocket. What a huge difference in maximum out of pocket in Beaufort County. There's a company with only a $3,400 max out of pocket, and there's some with $8,700, $10,000 out of network. You need to talk to somebody who can educate you on these things, guys. And what we can do, we can get that cancer plan, make it a $10,000 benefit. So if you get cancer, you got a $10,000. You not only paid your maximum out of pocket of, let's just say, $8,700, but you actually had a little bit of money left over for transportation and things that occur when you have cancer. All right, and you won't pay outpatient surgery. It helps pay for your skilled care. It's a plan. We take the $100 that this company gives us, and then we customize a indemnity plan. And this plan pays all the big stuff that can be scary for you that the Advantage plans don't. No underwriting necessary. Give me a call, 843-227-6725. Thanks.